My last video was cut short. I'm going to try and keep my videos from now on regarding LenapeValleyFoundation to 15 minutes or less because I think I'm losing people's attention. So this is, what is a lobotomy? This is from WebMD. Now what I want to explain to people. So now you have a focus in the mental health field on trauma, right? That's what they're trying to focus on here is trauma. But what you do not see a reduction is the use of poisons, of neurotoxins, to retard the individual and make them docile and to stupefy them, okay? So that's what you're not seeing. If you saw a focus on things like DBT and these things working, you would see a reduction in the use of these neurotoxins, okay? So lobotomy side effects, I just wanted to cover this again real quick. Bleeding after the operation, brain infection, dementia, epilepsy, intellectual impairment, disinhibition, epilepsy, apathy, incontinence, obesity, dementia. Now, I recommend going back to my video where I showed Dr. Bregan's views on these things. I think it's very important that you understand these are all the symptoms of severe brain trauma. Okay, these are what are called TBI, traumatic brain injury. So while the mental health industry is allegedly focusing on trauma and the role that trauma plays in mental health, what they are doing with the neurotoxins and the psychosurgeries, although they're not doing as many psychosurgeries, but they are increasing the use and abuse of neurotoxins, they are damaging the brain. Okay, they are causing severe damage to the brain. Moving on. So this is a video that I recommend people watch on a lobotomy from the National Institute of Health Archives. I love watching these videos. They're pretty good. So this is showing
6 centimeters above the zygoma in the coronal suture. The opening is made.
Now, mind you, what they're claiming is that by causing severe trauma to a healthy brain, because you have to remember, in the case of schizophrenia, in the case of bipolar disorder, in the case of obsessive compulsive disorder, there is no conclusive evidence that there is anything wrong with the individual's brain. Okay? No evidence whatsoever. This is an assumption made. Now, before I continue, I do want to explain, I am not a doctor. I'm not a physician of any kind. I'm not an MD. I'm not an ND. I'm not a DO. I'm not a nurse practitioner, I'm not an LPN, I'm not an RN, I'm not a dietitian, I'm not a nutritionist. This video does not constitute medical advice. If you have a medical question or a medical concern, seek the advice and counsel of somebody with a medical degree and a medical license. I am not such an individual. So don't take this video to be medical advice. This video, nor any other video on this channel, are actually medical advice. They're not, okay? So, moving on. What I want to point out, though, is what a lobotomy is this severe damaging of the brain in an attempt to create a situation where the person becomes docile. Well, if you've ever done combat sports or gotten into a fight and got hit in the head really hard, you'll find out that if you have a traumatic brain injury, you become pretty docile.
Corresponds to a point close to the sphenoidal ridge on the interior of the skull. The coronal suture on the inside of the skull is observed. Note again the sphenoidal ridge behind which the operator must not penetrate for fear of lacerating arteries. To the brain, the frontal lobe is bounded by the Sylvian fissure and the Rolandic fissure. The point of entrance of the knife is shown. Here is the Sylvian fissure with its large vessels. On the mesial aspect of the hemisphere, the genu of the corpus callosum lies here. The brain in approximately the plane of the coronal suture allows us to expose certain vital points. Observe first the corpus callosum and the association pathways. Next, the fasciculus cinguli and the anterior limb of the internal capsule. After dissection of the brain, these structures are more clearly seen. The fasciculus cinguli skirts the corpus callosum and runs down into the temporal lobe. The plane of the lobotomy incision lies just anterior to the head of the caudate nucleus. When the head of the caudate nucleus is removed, the fibers radiating forward from the thalamus are seen.
As you see, they are removing a healthy portion of brain.
Note the thalamus with its radiations into the temporal and the occipital regions, and its anterior radiation into the frontal lobe. Is lying on the table with his head shaved back as far as the vertex. The first mark is made 3 centimeters behind the lateral rim of the orbit, and then a cross mark is made 6 centimeters above the zygoma. Is made in the midline, 13 centimeters from the glabella. These points are joined by a line leading over the vertex, following as accurately as possible the coronal suture. The midline is similarly indicated. Operations can be performed under local anesthesia if the patient is sufficiently cooperative.
So keep that in mind. They would do these operations under local anesthetic, meaning the person was not even unconscious. They were fully awake. Can you imagine the traumatic experience of that?
An incision through the scalp along the indicated line exposes the coronal suture.
I'm going to move on. I just wanted to give you an idea. You can watch this on your phone. And it's linked in the description as always. So what is electroconvulsive therapy? Electroconvulsive therapy is a procedure done under general anesthesia in which small electrical currents are passed through the brain. It's performed for severe depression, treatment of resistant depression, severe mania, catatonia, agitation, aggression in people with dementia. ECT may be a good treatment option when medications aren't tolerated during pregnancy, in older adults who can't tolerate drug side effects, and people who prefer ECT treatments over taking medication when ECT has been successful in the past. Risks: confusion, memory loss, physical side effects, medical complications. Moving on. How do psychotropic drugs act on the brain? There are an estimated 100 billion neurons in the brain. Messages are passed along neuronal pathways in the brain via molecules known as neurotransmitters. The first sending, I'm going to get into this in my next video. So the so-called chemical imbalance hypothesis, a paradigm for understanding psychotropic drugs, antipsychotics. I'm going to get into this in my next video.